My name is Geoff McCleary. I'm Vice President and Group Director of Mobile Innovations for Digitas Health. So I oversee strategy and mobile development, thought leadership for all of the Digitas Health agencies. The rationale behind that was because we've seen a lot of data, the growing use of mobile for a number of reasons. And a number of uses, and one of the biggest was accessing mobile health information. But what we haven't seen a lot of is how specifically are users engaging with mobile health information based on a number of different criteria, based on what disease you suffer from, based on where you are in your experience life cycle. And what we wanted to do was really put together some research that kind of took a look at why that's occurring and what the specifics are around some of that use. Because it's really important at the end of the day, as in the European audience, we certainly look at physicians and pharmacists as more of our primary targets. But at the end of the day, it is the patient that takes the pill, and it is the patient that has to have the positive outcome from the involvement with that medication. And they're the ones that are doing the research. So both in the U.S. and here in the U.K., we wanted to make sure that we had a better understanding of that patient type and their mobile health activities. We looked at 2,000 patients and caregivers across 5 disease categories, and from the preliminary data that we're getting, we see some of the challenges to what conventional wisdom is that we're seeing skewing highly female. We're seeing more even distribution across age groups, which we didn't expect to see. Some interesting things, like we know that 66% of patients will take a prescription medication if recommended by a physician, whereas 90% will take an app. So we're finding some very interesting differences, and what we're really excited about is digging into the condition level data and really getting a better understanding of how that type of information, what types of engagement points, when you interact with mobile health, how that differs and changes across different disease types. I think the importance of this information and most of what was presented here today is really around getting a better understanding of how that pill and that medication is going to be used. How does that fit into the life of the human being that has to have an outcome? If you're diagnosed with diabetes, if you are diagnosed with cancer, if you are given a diagnosis of asthma, you're given a treatment or a medication, and you have to have an outcome with that. And I think it's really important, especially with mobile, to get an understanding of where that is and what that needs to be and how the patient journey and has changed and is influenced by all these new technologies that they're using. Quite frankly, they're using more actively outside of what pharma is providing. And we need to know how to be able to live and function in that environment. Yeah, I think in every one of the presentations we saw today examples of how patients are taking basically adherence and treatment to a whole nother level in their own hands without going to pharma. So they're downloading health apps, they're buying wireless scales, they're buying Fitbits and Nike Fuel Bands, and they're collecting data and they're using that data to better improve their general health outcomes or outcomes specific to a disease that they may have. They're doing that without prompting from us. Our research has told us that they're more than willing to spend money on that, and they're going to continue to grow in their usage of those things. So they're doing that adherence level activity already without us. Mm-hmm. And I think we, as experts in the drugs and the products that we make, have a great opportunity to be able to help them even further by providing even more information, tools, and resources to them for them to use in conjunction with our medicines. We talked a lot, and it came up in the summary at the end about this idea that there's a blurring of the lines between the product and the service. And at the end of the day, what does that new evolution of healthcare need to look like? think one of the biggest implications of mobile health is that we have to understand the contextual differences. So we have to look at different marketplaces. So the African or sub-Saharan user of mobile for health is very different than the UK user, which is slightly different from the US user. And I think it's, at the end of the day, although geared towards getting better healthcare, making better decisions, and having better outcomes. So whether it's a very robust SMS program in sub-Saharan Africa, or it's a multi-layered adherence program for mobile in the UK or the US, we have to get a better understanding in all of our markets how our users are using these devices and what they're able to accomplish with them, and how we can help them on their journey